Imagine a future where a single sophisticated algorithm can spot cancer, diabetes, or even rare tropical diseases long before you ever feel a twinge of pain, where the medicine you receive is not just generic, but tailored precisely to your unique DNA, your daily habits, and even the foods common in your hometown. Picture a world where artificial intelligence is not a luxury reserved for the wealthy elite, but the beating heart of a transformation that touches more than 270 million people, spanning from Jakarta's skyscrapers to the tiniest fishing villages scattered across over 17,000 islands. It sounds like the stuff of science fiction, but for Indonesia, this is not a distant fantasy. It is a bold, national mission already in motion, with stakes as high as the archipelago is vast, and consequences that could ripple far beyond Southeast Asia. But as Indonesia races ahead, pouring unprecedented resources into artificial intelligence and biotechnology, a critical question emerges. Is the nation truly on the brink of a healthcare revolution, or could these audacious ambitions bring new risks and unintended consequences, deepening the very gaps they seek to bridge? Let's rewind for a moment. In the past year, Indonesia's Ministry of Health has quietly set the foundation for one of its most significant technological leaps. In partnership with two of the country's most respected academic institutions, the Bandung Institute of Technology and the Dell Technology Institute, the government has signed a groundbreaking memorandum of understanding. Their aim is nothing short of transformative: to merge artificial intelligence, biotechnology, and the nation's vast and diverse health data into a seamless, equitable healthcare ecosystem. This collaboration is more than just a ceremonial press release. It's a comprehensive, long-term investment into research, talent, and infrastructure, aiming to create a healthier, more resilient Indonesia. Why the urgency? Indonesia's healthcare system faces challenges that are both unique and daunting. Visualize a country made up of more than 17,000 islands, spanning 3 different time zones, each with its own cultural tapestry. Urban centers like Jakarta bustle with state-of-the-art hospitals and clinics, yet many rural communities are hundreds of kilometers from the nearest doctor. In the highlands of Papua, or the remote hinterlands of Kalimantan, reaching a hospital may take days, not hours. Hospitals and medical professionals are unevenly distributed, with rural areas often lacking even the most basic services. Meanwhile, healthcare costs are rising steadily. Chronic diseases like diabetes and hypertension are becoming more common, and infectious outbreaks, think dengue, tuberculosis, or even new viral threats, remain a constant challenge. For years, these obstacles have seemed almost insurmountable, but the government now sees artificial intelligence and biotechnology as powerful tools to turn these challenges into opportunities. By harnessing data from across the country and building algorithms that understand Indonesia's rich cultural and genetic diversity, officials believe they can deliver healthcare that is faster, more affordable, and more accurate, reaching everyone from the heart of Jakarta to the furthest reaches of Papua. This vision is not just talk. The government has committed more than 3 trillion rupiah, equivalent to nearly 190 million United States dollars, for the coming year alone, fueling a wave of research centers, pilot programs, and strategic partnerships. New centers for artificial intelligence in healthcare have opened, staffed by teams of local and international experts. The Bandung Institute of Technology has launched a department focused solely on developing algorithms tailored to Indonesia's unique health profiles, while the Dell Technology Institute is collaborating with the University of Oxford to train the next generation of doctors and engineers in artificial intelligence and biotech. Health Minister Budi Gunadi Sadikin puts it plainly: we cannot always depend on foreign technology. We must be able to create our own innovative measures, particularly in healthcare, which is very strategic for our nation's future. This push for self-reliance is about more than just technology. It is about cultivating homegrown expertise, safeguarding national data, and ensuring that innovations are truly made for Indonesians, by Indonesians. Yet, as laboratories buzz with activity and classrooms fill with eager students, a deep unease has crept into Indonesia's medical community. The promise of artificial intelligence-driven healthcare is immense, but so are the risks. According to a recent survey by the Indonesian Medical Association, nearly 2/3 of doctors, about 65%, express moderate to high concern about the ethical implications of artificial intelligence in medicine. Their main worries? Patient data privacy, the potential for unchecked bias in algorithms, and the fear that machines might override the nuanced judgment of human doctors. Judgment built on years of experience and an intimate understanding of local culture. Dr. Erna Tri Wahyuni, chairwoman of the Indonesian Medical Association, warns, While artificial intelligence holds immense potential, it is essential to address the ethical concerns and ensure that artificial intelligence-driven healthcare decisions are always validated by human doctors. Her words reflect a broader anxiety, not just about technology, but about the risk of losing the human touch, the empathy, intuition, and context that no algorithm, however advanced, can fully replicate. Let's dig deeper into these concerns. Imagine a scenario where an artificial intelligence tool, trained mostly on data from urban hospitals, is used to diagnose patients in a remote Sumatran village. The algorithm may miss signs of diseases that are rare in the city but common in the countryside, or misinterpret symptoms because it lacks knowledge of local dietary habits or environmental exposures. For instance, an artificial intelligence tool might overlook a vitamin deficiency common in rural diets, or misdiagnose a tropical infection unfamiliar to algorithms trained on Western datasets. Worse still, if patient data is not adequately protected, a single breach could expose the private health information of thousands, even millions, of Indonesians. Such incidents have already marred artificial intelligence rollouts in other countries, leading to public outcry, lawsuits, and a loss of trust that can take years to rebuild. To address these risks, Indonesia has introduced new regulations. Every artificial intelligence-powered medical device or solution must now undergo rigorous testing and certification by the Indonesian National Agency of Drug and Food Control before entering clinical use. These protocols are designed to catch algorithmic bias, ensure safety, and guarantee that artificial intelligence recommendations are transparent and explainable. The government is also piloting a national health data platform with strict privacy protocols, aiming to facilitate secure data sharing between hospitals and research institutions while giving patients more control over their information. Encryption, access controls, and patient consent mechanisms are now required by law, setting a new standard for data governance in the region. But the challenge goes beyond technology. The success of this revolution depends on people, on doctors, nurses, engineers, policymakers, and most importantly, patients themselves. The Ministry of Health, together with academic partners, is rolling out intensive training programs to upskill healthcare workers. These programs are designed to ensure that medical professionals can interpret artificial intelligence outputs, understand their limitations, and make informed, ethical decisions. The Dell Technology Institute's partnership with the University of Oxford, for example, will bring world-class expertise to Indonesian classrooms, creating a new generation of professionals fluent in both medicine and machine learning. Dr. Inez Wiharjo, an artificial intelligence researcher at the Bandung Institute of Technology, emphasizes, "The success of this collaboration depends on our ability to develop artificial intelligence algorithms that are not only accurate, but also culturally sensitive and aligned with the values of Indonesian society." Her team is working on diagnostic tools trained specifically on local health data, tools that, for instance, recognize genetic markers common in Javanese or Batak populations, or that take into account traditional herbal remedies often used alongside Western medicine. The ambition is to create a healthcare system that respects and incorporates Indonesia's rich medical traditions, rather than replacing them. Meanwhile, the Indonesian Biotechnology Consortium is advocating for the creation of a national biobank, a massive repository of biological samples and genetic data from across the archipelago. Such a biobank would accelerate the discovery of new drugs and therapies, tailored to Indonesia's unique epidemiological landscape, addressing diseases that may be overlooked by global pharmaceutical giants. Biotechnology expert Dr. Antonius Malau explains, "Biotechnology research in Indonesia needs a boost, and this collaboration provides a platform for us to leverage artificial intelligence to accelerate drug discovery and develop personalized therapies." The government's vision is clear. Artificial intelligence and biotechnology will not just treat illness, but prevent it. Imagine rural clinics equipped with smart diagnostic kiosks, able to detect early signs of tuberculosis or dengue, using just a drop of blood and a few clicks. Or picture a future where cancer is caught months, even years, earlier than today, through artificial intelligence analysis of medical images and genetic data. According to a study by the Center for Strategic and International Studies Indonesia, widespread adoption of artificial intelligence-driven healthcare solutions could reduce national healthcare costs by as much as 1/4 by the year 2030, freeing up billions for investment in preventive care and rural health infrastructure. But with these benefits come new ethical and societal challenges. Data privacy is paramount. One high-profile breach could erode public trust for years, stalling progress and putting lives at risk. That is why Indonesia's new National Health Data Platform incorporates state-of-the-art encryption, and gives patients more say over how their data is used. There is also the issue of algorithmic bias. If artificial intelligence tools are trained on data skewed towards urban, male, or wealthy patients, the recommendations could misdiagnose or underserve women, rural populations, or ethnic minorities. Continuous oversight, regular audits, and transparent reporting are now required by law to root out these biases before they can do harm. Looking ahead, the role of healthcare professionals will evolve. Artificial intelligence is not here to replace doctors or nurses, but to augment their abilities, helping them spot patterns they might otherwise miss, or offering second opinions in complex cases. Yet there are concerns about de-skilling. If professionals become too reliant on artificial intelligence, they may lose critical thinking and problem-solving skills vital in situations where technology fails. The government's training programs place special emphasis on maintaining clinical judgment and encouraging a healthy skepticism, ensuring that technology remains a tool, not a crutch. Professor Titik Karlina, a respected health policy analyst at Universitas Gadjah Mada, cautions, "The government university's collaboration has the potential to revolutionize Indonesian healthcare, but it is crucial to address the disparities in access and ensure that the benefits of artificial intelligence and biotech reach all segments of the population." Her warning highlights a persistent risk: the digital divide. If new technologies are rolled out primarily in major cities, rural and disadvantaged communities could fall even further behind, exacerbating existing inequalities. To counter this, the government is investing heavily in telemedicine infrastructure, mobile health clinics, and targeted subsidies to bring cutting-edge care to underserved regions. Let's consider a practical example. In West Papua, where specialist doctors are scarce, a pilot program has equipped community clinics with artificial intelligence-powered, portable ultrasound devices. These tools, combined with remote consultations by experts in Jakarta, have already improved maternal health outcomes and reduced complications during childbirth. Similar pilots are underway in Sumatra and Kalimantan, focusing on early detection of infectious diseases and chronic conditions like hypertension. In Sulawesi, new artificial intelligence-driven tools are being used to monitor outbreaks of malaria, helping local authorities respond faster and more effectively than ever before. Tax incentives are also being offered to companies that invest in artificial intelligence and biotech research and development, encouraging local startups and established firms alike to tackle Indonesia's most pressing health challenges. These policies are expected to spark a wave of innovation, bringing fresh ideas and homegrown solutions to market. Already, several Indonesian startups are developing mobile apps that use artificial intelligence to triage symptoms and provide early warnings for diseases like dengue or measles. Still, the journey will not be easy. Regulatory hurdles remain, particularly around the use of genetic data and cross-border data sharing. Talent development is an ongoing challenge, with a pressing need for more engineers, data scientists, and bioinformaticians trained in the ethical use of artificial intelligence. Indonesia is looking to international partners for support, but is determined to build its own capacity for the long term. The government has outlined a multi-year national artificial intelligence strategy, identifying healthcare as a top priority and setting ambitious targets for research, deployment, and workforce development. For anyone watching from outside Indonesia, these developments offer important lessons. The future of healthcare will not be decided by technology alone, but by the values, policies, and collaborations that guide its use. Indonesia's approach, a blend of local innovation, international partnership, and robust regulation, could serve as a blueprint for other emerging economies grappling with similar challenges. The story of Indonesia's artificial intelligence revolution is, in many ways, a story about inclusion, about ensuring that the benefits of technology reach the many, not just the few. Let's take a step back and consider the global context. Across the world, countries are grappling with the promise and perils of artificial intelligence in healthcare. In the United States, artificial intelligence-driven diagnostic tools have shown great promise, but have also faced setbacks due to algorithmic bias and data breaches. In Europe, strict regulations ensure privacy, but sometimes slow innovation. Indonesia's challenge is to forge a path that balances speed with safety, ambition with accountability. What can individuals do, whether you are a policymaker, a technologist, a healthcare worker, or simply a concerned citizen? First and foremost, stay informed. Participate in public discussions about the role of artificial intelligence in healthcare, and advocate for transparency and accountability. Support initiatives that promote digital literacy and ethical technology use, especially in rural or marginalized communities. If you work in healthcare, seek out training on artificial intelligence tools and their limitations, and always place patient welfare above technological hype. Citizens and patients should assert their rights over personal health data, asking questions about how information is stored, shared, and protected. The government has made patient consent and data protection central pillars of its strategy, but meaningful oversight requires ongoing public engagement. Community groups and non-governmental organizations can play a vital role in educating the public and ensuring that diverse voices are heard in policy debates. For technology companies and researchers, the message is clear. Success in Indonesia will depend not just on technical sophistication, but on cultural sensitivity, ethical rigor, and a deep commitment to inclusivity. The most impactful projects are those built on collaboration between doctors and data scientists, policymakers and patients, urban and rural communities. Initiatives like the proposed National Biobank, for example, will only succeed if they earn the trust and participation of communities across the country. Let's not forget the importance of continuous evaluation. As new artificial intelligence tools and biotech therapies are rolled out, ongoing monitoring will be essential to catch unforeseen problems and ensure equitable outcomes. The government is establishing independent oversight bodies, drawing on international best practices to ensure that artificial intelligence and biotech innovations are safe, effective, and fair. Can Indonesia create a fair, ethical, and inclusive artificial intelligence healthcare revolution? The answer is absolutely, but only if transparency, local context, and ethical oversight remain front and center. The journey is just beginning, and the world is watching closely. The next few years will be crucial as Indonesia tests, refines, and scales its most promising innovations. Here is a little-known fact. Indonesian scientists are already developing artificial intelligence algorithms trained specifically on national health data, making diagnostic tools that are more accurate for their own people than imported solutions. This homegrown approach could soon put Indonesia at the forefront of personalized medicine in Southeast Asia, setting new standards for how technology can serve diverse populations. Already, early results from pilot studies show that artificial intelligence models trained on Indonesian data outperform foreign models in diagnosing diseases like hepatitis and dengue. A glimpse further into the future reveals even bigger possibilities. Imagine Indonesia as a regional hub for artificial intelligence and biotechnology research, exporting expertise to neighboring countries and attracting international investment. With continued commitment to ethics, equity, and excellence, such a vision is within reach. Partnerships with leading institutions in Singapore, Australia, and Japan are already on the horizon, aiming to position Indonesia as a leader in digital health innovation across the Asia-Pacific region. So what do you think? Can artificial intelligence truly bridge the healthcare divide and make medicine fairer for all? Or are the risks too great? Share your perspective in the comments below. And if you are passionate about how technology is reshaping our world, make sure to subscribe for more stories.